Hello and welcome back to my channel. Today we're talking about a condition that affects the way your muscles work, myasthenia gravis. If you've ever experienced unexplained muscle weakness, trouble swallowing, or fatigue that worsens with activity, you might have wondered what's going on. Myasthenia gravis is a chronic autoimmune disorder that disrupts communication between nerves and muscles, leading to weakness that can impact daily life. In this video, we're going to break down what myasthenia gravis is, its symptoms, how it's diagnosed, and the management strategies available to help people live a fulfilling life with this condition. Hi, I'm Dr. Knapp, family medicine physician, here to bring you medical information so you can take control of your health and make the most of your doctor visits. Let's get started. To understand myasthenia gravis, we first need to understand how muscles work. Normally, nerves send signals to muscles using a chemical called acetylcholine. This neurotransmitter binds to receptors on muscle cells, allowing the muscles to contract. In myasthenia gravis, the immune system mistakenly produces antibodies that block or destroy these receptors. As a result, the signals from the nerves don't reach the muscles effectively, leading to muscle weakness and fatigue. The severity of symptoms can vary from person to person, and the condition can affect different muscle groups. One of the hallmark symptoms of myasthenia gravis is muscle weakness that worsens with activity and improves with rest. This can affect different parts of the body, leading to a range of symptoms. The most commonly affected muscles are those that control the eyes and eyelids. Many people with myasthenia gravis first notice drooping of one or both eyelids, known as ptosis. They may also experience double vision or diplopia because the muscles that control eye movement become weak and uncoordinated. Beyond the eyes, myasthenia gravis can affect the muscles involved in speaking, swallowing, and breathing. Some people develop difficulty speaking clearly, known as dysarthria, and may notice that their voice becomes softer or more nasal over time. Swallowing problems, or dysphagia, can make eating and drinking challenging, sometimes leading to choking or aspiration. In severe cases, myasthenia gravis can weaken the muscles that control breathing, a potentially life-threatening condition called myasthenic crisis. Other muscle groups, including those in the arms and legs, can also be affected. Weakness in the neck muscles may make it difficult to hold up the head, while weakness in the arms and legs can cause difficulty with everyday tasks like lifting objects, climbing stairs, or even walking. The severity and pattern of muscle involvement can vary widely from person to person. Some individuals have mild symptoms that primarily affect the eyes, while others experience more widespread muscle weakness. Diagnosing myasthenia gravis can be challenging because its symptoms can mimic other conditions. A healthcare provider will typically start with a thorough medical history and physical examination, paying close attention to the pattern of muscle weakness. A key feature that helps distinguish myasthenia gravis from other conditions is that the weakness worsens with use and improves with rest. Several specialized tests can help confirm the diagnosis. One common test is the edrophonium test, which involves injecting a short-acting drug called edrophonium to see if muscle strength temporarily improves. This test is particularly useful for diagnosing cases that primarily involve the eyes. Another important test is electromyography, or EMG, which measures how well nerves communicate with muscles. A specific type of EMG, called repetitive nerve stimulation, can reveal a characteristic pattern of muscle fatigue seen in myasthenia gravis. Blood tests can also be helpful in diagnosing the condition. Many people with myasthenia gravis have antibodies that attack the acetylcholine receptors or other proteins involved in nerve-muscle communication, such as muscle-specific kinase. Identifying these antibodies can confirm the diagnosis and provide insight into the severity of the condition. In some cases, imaging studies like CT scans or MRI may be performed to check for a thymoma, a tumor of the thymus gland that is sometimes associated with myasthenia gravis. Once a diagnosis is made, the next step is management. While there is no cure for myasthenia gravis, various treatments can help control symptoms and improve quality of life. The primary goal of treatment is to improve muscle function while reducing the immune system's attack on nerve-muscle communication. One of the most commonly used medications for myasthenia gravis is pyridostigmine, a cholinesterase inhibitor. This medication works by increasing the amount of acetylcholine available at the neuromuscular junction, helping to improve muscle strength. While pyridostigmine is effective for many people, it does not stop the underlying immune attack and may not be enough for more severe cases. For individuals with more significant symptoms, immunosuppressive therapies are often used. Corticosteroids such as prednisone can help reduce the immune system's attack on acetylcholine receptors, but long-term use can have side effects like weight gain, high blood sugar, and osteoporosis. Other immunosuppressive drugs, such as azathioprine or mycophenolate, may be used to reduce reliance on steroids and provide more long-term immune regulation. In severe cases or during a myasthenic crisis, more intensive treatments may be needed. Plasmapheresis, also known as plasma exchange, is a procedure that removes harmful antibodies from the blood, providing temporary symptom relief. Intravenous immunoglobulin, or IVIG, is another treatment option that helps regulate the immune response. Both of these therapies are often used in emergencies or to stabilize patients before surgery. Speaking of surgery, the thymus gland plays a significant role in myasthenia gravis for some people. If a thymoma or tumor of the thymus gland is present, surgical removal of the thymus, called a thymectomy, is often recommended. Even in people without a tumor, thymectomy may still help improve symptoms over time, particularly in younger patients. Research has shown that removing the thymus can lead to long-term improvements and may reduce the need for immunosuppressive medications. Beyond medical treatments, lifestyle modifications can play an important role in managing myasthenia gravis. Avoiding triggers that worsen symptoms, such as excessive heat, stress, and infections, can help maintain stability. Many people with myasthenia gravis find that planning activities with periods of rest in between can help prevent excessive fatigue. Physical therapy can also be beneficial in maintaining muscle strength and function without overexertion. Supportive care is crucial for those living with myasthenia gravis. Working with a neurologist and a multidisciplinary team, including physical therapists, speech therapists, and occupational therapists, can help address specific challenges related to muscle weakness. Support groups, whether in person or online, can provide emotional support and practical advice for managing daily life with this condition. While myasthenia gravis is a lifelong condition, advances in treatment have made it much more manageable. Many people with myasthenia gravis can lead active, fulfilling lives with the right combination of medication, therapy, and lifestyle adjustments. Early diagnosis and proper management are key to reducing complications and improving overall well-being. If you found this video helpful, please give it a thumbs up and consider subscribing for more medical content. If you or someone you know has been affected by myasthenia gravis, feel free to share your experience in the comments. Remember, awareness and knowledge are powerful tools in managing chronic conditions. Thank you for watching. As always, take care of yourself and make the most of your day.